Welcome, everybody. A very good afternoon. I am Atrik from SBE, and
And I am Krishna from IEEE EMBS.
for today's session of Coffee with CEO, we are joined by a very special guest, Mr. UK Ananthapadmanabhan, Director of Tenx Technologies, Coimbatore. He's presently the director of a health IT startup company, which is involved in the design and development of health IT software products and services using emerging technologies. He is also on the board of MGM Healthcare, Chennai. He's one of the senior most professional health hospital administrators in the country. During his long career in the healthcare industry, he has held various senior leadership positions in large hospitals like Apollo Hospital, Pugai Medical Center and Hospital, Continental Hospital, Meenakshi Mission Hospital, Tata Hospitals, Kavri Hospital, Sundaram Medical Foundation, Rainbow Children's Hospital, and MGM Healthcare. In these hospitals, he has been actively involved in planning and designing hospital facilities to provide quality care to patients at a very low cost. Planning and designing healthcare information technology with emerging technologies like IoT, cloud computing, artificial intelligence, and machine learning has been his forte. As a part of his corporate social responsibilities activity, he's running a campaign called Hand Wash India Campaign. For the past 4 years, with a mission to teach and train a million poor Indian children on the importance of hand washing with soap. About 10 students of VIT have been doing an internship with his company, Tenxhealth. Sir, we warmly welcome you to today's session, and I hope we can learn from all the values that you have to teach us today in today's session. Thank you, sir.
Thank you, Saha, for this wonderful introduction. It is my proud privilege to be a part of I have always had the fortune of working with young students like you. I've been involved in teaching, training the young students during the last maybe 15 to 20 years. And I have been more inspired by the students, rather, I inspiring the students during my course of my so many years of teaching and training. So today's topic, InsureTech. The InsureTech is a very emerging technology, particularly in healthcare. So what I thought was that I will talk to you about healthcare insurance, about insurance, and then take you into the InsureTech space with a lot of case studies and all that. But so I just want to share my screen. Can I do that now?
Yes, sir. Yes, sir.
Yes, sir, you may go ahead.
Am I audible? Okay.
Yes, sir. Yes, sir. You're audible.
Are you able to see my screen? Are
Yes,
you
sir.
able to see my screen?
It's loading, sir. Yes, sir. It's visible.
It's loading, sir.
Loading,
Is
sir.
this screen? Good, good morning, and can I go ahead, Krishna and Saha?
Yes, sir. Yes, sir. Please
Yes,
go
sir.
ahead, sir.
You may proceed, sir.
Can I go ahead?
Yes, sir. Yes, sir. Yes, sir. Go ahead, sir.
And Shirley and the group. So I'm able to see you guys, but I do not know how many are participating in this YouTube presentation. Innovative and emerging trends in InsureTech in healthcare. This is a subject which is very close to my heart. You know that insurance in India is catching up, particularly in health because of this COVID, and there has been a great. Quickly, what I am going to do is to take you through some important concept of insurance tech and maybe talk to you about basic insurance, and how the health insurance in and how we are using, how people like us in our hospitals are put to use. Um, Maybe I should tell you at this stage that healthcare as an industry has been little slow in adopting technology in retail, transportation, and automobile. I think healthcare has been little lagging in the space of technology. But we were able to see the impact of this technology in healthcare around 2014 to 15, when people talked about Industry 4.0, when we moved from Industry 1.0 to 4.0. Industry, we saw the automobile industry was slowing down, and autonomous vehicles were all catching up. Electrical powered vehicle were catching up, and so on. That led to a lot of job losses, and we may have to retrain and train the people. But even then, I think healthcare did not take cognizance of this Industry 4.0. And happened was when this COVID-19 pandemic struck us, I think it was a tsunami. Believe me, in healthcare, it was a tsunami because the healthcare workers like doctors, nurses, even housekeeping workers were on the front line. And the viral loads were increasing because they were very close to the patient. And it was then people talked about remote sensing, remote monitoring, minimum touch, no touch, and I think people started asking about social distancing and things like that. And that is where the point of intersection happened. So you had Industry 4.0 and you had COVID-19 came together. I think that was a point of deflection, and everyone started realizing the consequences of not adopting technology. So they realized that what like Dr. Abdul Kalam said, that technology is a tool for social transformation, and we have to use them very, very effectively. When that was happening, we found that even then, some of the hospital promoters, hospital investors, senior leadership in the hospitals, most of the promoters did it, but some of them still did not do it for their own good reasons. Maybe, I don't know, because of transparency and things like that, they were little concerned. And on the other side, we had CTOs, we had technologists, were quite surprised to see that there was a lot of talk about digital transformation in hospitals. People who did not talk about digital technology started delivering like that. And finally, I realized people like us were evangelizing the healthcare technology. We were championing the cause of healthcare technology for almost 10 to 15 years. We found that what CTOs could not do, I think COVID-19 did it. And so now there has been a lot of budget allocation for digital health. The push from the government he also did a lot of some of the legislations like telehealth, teleconsultation, which were languishing for years together, got passed by the government got the government within a matter of few days. So now you find teleconsultation happening in a large measure. But people like us believe that we have to go much further. Consultation is not an end of everything. So we said we should look at technologies like cloud computing, IoT, artificial intelligence, and maybe machine learning. I think the technology came into healthcare, but the technology did not come so much into healthcare insurance. So what I thought was how we could, people like us in the industry, could do better service to the community, provide better patient experience and customer experience. So we went on exploring, and we found there were tremendous opportunities. There were fantastic opportunities in technology in healthcare. And we believe that insurance is a great driver of funding the hospitals, providing quality care to the hospitals, and they are also what I'm going to do is to quickly take you through with this background. I'm going to quickly take you through a few slides. Maybe I may be a little fast. Maybe you may even find that it is little heavy on you on a Sunday morning. But believe me, after this session, you will not regret that 2 hours you spent in this session. So what is InsureTech? InsureTech refers to the use of technology innovations designed to squeeze out the savings and efficiency in the current insurance industry model. InsureTech is we have been hearing about fintech, and I understand this is I don't know how really to pronounce it, is portmanteau. So this the putting together two words is in English is called portmanteau, and it is spelled out manchu. So I think this is interesting. And so what is insurance and what is health insurance? Believe me, insurance is a great concept. Insurance is a social concept of public good. Insurance is around 20 to 25,000 rupees per annum for our family. We have 4 members for the past 20 years. Thank God, we were very fortunate. We have not used that 4 lakhs or 5 lakhs for any of the hospitalization. So grow older. But the fact remains that I have paid about almost about 5 to 7 lakhs as insurance premium in the last, say, 10 years. But what I have done is I have not only covered the risk of hospitalization to me and my family, but I have also contributed to the health of somebody in Meghalaya, somebody who had an accident in Jaipur. So this is a very, very interesting concept. This is a social concept where people put the premium into one pool, and that money it is something like a chit fund. It is running a chit fund, and so you can get benefited, or you can reap the benefit at the last after some time. So this is a social concept. I feel that this insurance, particularly health insurance, is very, very good for this country. And this health insurance is a process of transferring the risk of high healthcare cost of an individual or a family or a group of people indemnifies payment, that is the insurance company. So what is the need for health insurance in India? Very quickly, 70% of the Indian populations pay for healthcare from out of pocket. Many families go to pay for open heart surgeries, kidney transplant for some of their children, and maybe parents or maybe spouses. So this is not a very good situation at all. So there is a lot of need for health insurance. And rapid equipments like MRI, CT scan cost about 4 crores, 5 crores, and so cost of those diagnostic sets have increased rapidly in the last 7 or 8 years. And it is a very good means of funding the healthcare. 1.2% of the GDP on healthcare. It cannot spend any more. They are saying that they are going to double the investment in healthcare in another 5 years' time, as per the budget indications. But I do not know if this is going to happen, because as the insurance base increases, when more and more people start paying insurance premium, there will be a lot of money in the kitty. And so a lot of procedures will be done in the hospital who need it. And as the procedures are being done, the hospitals will have money to expand, hospitals will have money to put up new facilities and things like that. And this is a very regulated, nice way of funding healthcare. And this is a very good concept. and it is the best driver for improving quality of medical care through organizations like regulate the prices. They are not only the trustees of our money in terms of insurance premium and the money we pay to the hospital. We pay through the insurance company. We don't directly pay when we have an insurance policy. And so they have the purpose of it. They not only cover the risk, but also get us the best price by doing bargaining with the hospitals. But they also carry another responsibility, very clear. IRDA has made it very clear that that unless a hospital is accredited by National Accreditation Board for Hospitals, you cannot get cashless facility. Criteria for empaneling hospitals. These insurance companies ensure that all these hospitals are NABH accredited. But just getting the stamp of NABH is not okay. But the insurance companies, quality of care we get, they are also expected to go and find out whether the temperature in the refrigerator where the medicines are stored is correct. Is it between -2 degrees to -7 degrees? They should also find out whether the waiting times of patients are correct. They should also share that responsibility. When they say that NABH accreditation is required, I think they should also look into some of the aspects of the quality of the hospital. And I'm going to tell you how insurance companies can benefit to evaluate. I told you it's a mechanism of collective bargaining for patients with hospitals for getting most competitive rates for investigations, procedures, and surgeries. When you say investigations, it is lab tests. When you say procedures, it is angioplasty, maybe open heart surgeries or something like that. And I think very quickly, this is an interesting storyline. I must share you this because these stories in the course of my last 20, this went on to reinforce why insurance is required, why health insurance is required in this country. When MGR got admitted in the Apollo Hospital in 1985, I was the general manager there at that time. He stayed in the hospital for about almost 1 month. Then afterwards, we sent him by a special aircraft to United States. That's a different story. But the amount of money that you would have spent is a humongous of amount of money. But that money, I guess, was paid by the government, and so he didn't need for the money. Government was the payer. In some form, it was the payer for that patient. Second thing is, this is again a very interesting example. This is one fine day in the night at about 10 o'clock. I got a call, and I was told that he and four of his relatives, husband, wife, 2 children, and mother-in-law got hurt in a huge car traffic transported to KMCH, Core Medical Center, where I was the president. I said, please bring them over, and we brought them over by about night 2 o'clock, and by about morning 9 o'clock, all the 5 of them were undergoing surgeries in the 5 different theaters. They stayed in the hospital for about 1 month. Somebody had head injury, somebody had a leg injury, somebody had a stomach injury. But believe me, they were all right, and it was quite a huge sum of money for 5 people in 1 month in a super specialty hospital. You can imagine TCS, because already they had an insurance coverage done through this. So insurance helped them. Secondly, mass casualties in Coimbatore bomb blast. I was there when the Coimbatore bomb blast happened. So when the bomb blast happened, ambulances coming to the hospital with 3 cases, with somebody lost their leg, somebody lost their hand, somebody lost their nose. Practically nose was not there at all. So I had to handle them. Of course, we treated them. We didn't ask money. But the point here is, after these procedures were done, government said we will bear the cost, and they made some arrangements to pay some money to all the hospitals who treated this Coimbatore bomb blast victims. Another interesting Ooty Hills, and then the bus toppled over, and about 40 people were, they are grievously injured, and about 10 people came to our hospital. Two ambulances, three ambulances came with, the patients stacked in first sleeper, second sleeper, third sleeper. They were all stacked there. They came. I received them, and some of them honestly tell me. I have to honestly tell you that some people died, but many people we saved them. But then I was a part. I knew that the father was gone, but the daughter was there. And the daughter was asking on, where is my father? Where is my father? I said, she will come, she will come. But after about 1 month, after about maybe 15 days, psychiatric, and each of them had to pay a lot of money, but some borrowed money, some asked for credit, some paid through insurance and all that. And this is a very interesting case. As early as 1991, villages Nalambati, and she was bitten by a cobra snake. And her mother, they were a farm laborer. Her mother paid about 20,000, 30,000. We treated them for about almost 1 month, and she was undergoing dialysis. And after about 1 month, when she had paid about 60 or 70,000 rupees, mother came and told my chairman, if she dies, it is okay, but I cannot afford anymore. It was at that time I think we realized that insurance is so important. My chairman said, don't worry about it. Even if it costs another 10 lakhs, we'll save your daughter. He kept up his word, and then the daughter went back. She is still doing good, and his children are all in engineering, engineers and doctors and things like that. But the point is, what happened to the money? What happened to the cost of treatment? Who bears it? That was the question. The last but not the least is the best story I can tell with reference to insurance. We were doing kidney transplants for our patients, and people used to come from Bengal, come from Madhya Pradesh, and we used to have dialysis. Suddenly the government clamped, saying for some reason that you can't do transplantation, although the approvals were got from the government of Tamil Nadu, and all the procedures were adhered to. And suddenly when it was stopped, they are incurring every month, they were incurring about 5,000 rupees, 6,000 rupees dialysis expenses, but not knowing when they get the transplant. But believe me, at that time it was people used to come and fall at the feet of my in Coimbatore Medical Center, went to the court. We went to the court and filed a case against the government, saying that you have approved these 15 people, and you must allow them to get transplantation done. Believe me, the senior lawyer Somayaji, Justice Venkatraman at that time, I was in the court. I have never gone to the court, but I saw that. And finally the judgment came. The Venkatraman Somayaji won the case. Venkatraman gave a judgment that these 20 patients can undergo kidney transplant, and all the 20 patients. But the point is, what about the money? What about the cost of treatment? Who is going to bear? I think the solution is only health insurance. A solution is only healthcare insurance take. The money is spent effectively, money is spent usefully, and you give the best patient care to the patients, and that's what it is. So coming back, the health insurance is all about community. How we had COVID-19, how could we provide them insurance? It is about empathy. It is just not about an insurance agent coming and selling insurance policy to you. It is about putting yourself into their shoe. It is about sympathizing with those people. Accident or whatever, and helping the people in crisis. That is very, very important. I'm going to tell you one story where an accident victim was helped in a matter of about 4 or 5 minutes, and he was able to come back. When somebody has an accident, when somebody has a heart attack, the hours and minutes matter. So if you have a good technology, we can reach the patient in hours, or you can reach the patient in minutes, depending upon the distances and things like that. And the patient, maybe we may not be able to solve his personal problems. We may not be able to solve his problems with children, and maybe not his job and things like that, but definitely we can help them to pay for the medical expenses, Suresh. Sharing the medical treatment costs in the community is a great virtue, and it's a great service. People like us pay insurance premium. Can you believe I donate insurance premium? I do not pay for the healthcare, but I make it a point to spend about 40 to 50,000 rupees every year only on insurance premium for young children, poor children, and college students. I thought that is a good way of promoting health insurance. And also, I don't want to give cash, but definitely I want to give insurance premium, and that should be the commitment of the to help people must be there. And the knowledge and education about health insurance policy is very important. Even today, many people don't know what is the difference between health insurance and accident insurance. Maybe a little bit of medical treatment, but health insurance not only covers the accident, the medical expenses arising out of an accident, but also other illnesses like cancer, tumor in the brain, or maybe so this is what health is about. And quickly, we should also know something about some of these terminologies. I'm not going to get deep into it because our focus is on healthcare tech, but this fundamental understanding of insurance is what do you mean by insurance. Life and non-life insurance, maybe all these Mediclaim and all come under non-life, but whereas life insurance is your LIC policy, your life insurance policies come under life category. And there is one regulatory authority called IRDA, which is a very important regulatory authority in the country, which regulates rules and requirements of the insurance industry, whether it is in automobile or healthcare or in any other industry. It is a regulating authority, and insurance premium is what you pay to coverage of about 5 lakhs. That is the coverage amount, and 25,000 is the premium amount. And once you pay that, you get an insurance policy. Keep that insurance policy very, very carefully. Keep those their reference data, because we don't know when we really require 5 lakhs. Then 4 of your people can, your family can share that insurance amount. One time, maybe your father used about 1.5 lakhs, maybe your sister used 50,000, and maybe in a year, all of you used to take individual policies. And then you should look for empaneled hospitals is a concept where all these insurance companies, be it Star Health Insurance, be it Lombard, ICICI Lombard, be it Apollo Munich, they empanel some hospitals. People like Dr. Prakash, who is the MD of Star Health, that we should develop a criteria for smart hospitals. In fact, I have given them the list, some of these criteria which should evaluate, and they should evaluate the hospitals, and then they should give them a star that these hospitals are smart hospitals, they are completely digitally transformed, and it is more safer to go to that hospitals. So anyway, the insurance companies are giving option for the insurance policy holders to go to any of the empaneled hospitals. Like empaneled hospitals are classified as super specialty hospitals, specialty hospitals. All hospitals must be also look for the digital content in that hospital, and then you must rate them. I think that is very important. It is good that these insurance companies are going to get benefited because of this, developing the smart hospital concept. Pre-authorization is one which you pay the insurance premium, get hospitalized, then the hospital has to send that detail to the pre-authorization is one thing which you should understand. And this may be important when it comes to InsureTech, because these details have to go into through that cycle of technology cycle. Disallowed amount is that you claim 5 lakhs, but they give you only 3.5 lakhs. They disallow for some reason because it was a pre-existing disease which you cannot be covered, and things like that. All that come under the insurance. And then the accident, then you have accident and health insurance policies. These are all some of the health insurance policies. These are different policies that are available. I don't want to talk about it. When you're talking about health insurance policies, health insurance for individuals, family, floater health senior citizens scheme, and on the healthcare tech. So So these are all some of the important healthcare insurance companies. I have been talking to these companies to adopt InsureTech so that their policyholders can be benefited. There are about 20 very active: Bajaj, Star Health, Apollo Munich, Cholamandalam, HDFC, ICICI, IFCO Tokyo, National Health Insurance, New India, Oriental, and United India. You must understand in these insurance companies, you have got private insurance that they should all up InsureTech, whether the government insurance companies will be able to adopt faster. But let us not underestimate the power of the government organization. SBI is one of the government bank and they have completely digitalized their entire operation. I understand the SBI website and SBI digitalization is much better than the many of the private banks. So what are all challenges? My only challenge is if you are talking about Jallikattu can get so much of publicity, but unfortunately the 50 children dying in Lucknow hospital due to oxygen shortage, or 1,000 farmers continuing to commit suicide unable to pay for their debts. For all you know, somebody would have got sick, somebody would have got sick and they would have got into debts. So please understand, almost about 20 to 30% of the indebtedness in the farming community happens because of their health. And the irony is, dead body is being carried on the shoulder because of their health. Why we should focus more on these issues than maybe other issues. I don't want to get into any controversy here, but the point is, young people like you should focus on more pressing issues because the challenge is that poor awareness, public awareness on the need and benefit of health insurance is a big problem. Then the cost of insurance premiums are rising because of the small health insurance. This is very important. See, if we in the country, maybe 40 to 50 crores is covered by the government, and thanks to Ayushman Bharat, so about 50 crore people or 60 crore people are going to be covered and by the government, either state government or the central government. But what happens to the middle class? What happens to the upper middle class? What happened to the other people who don't come under that BPL category, and they have to be insured? And it is like China, half cup, half full, half empty story where there is so much of opportunity for health insurance here. And the claim settlement process is cumbersome, time consuming, and transparent. They say, okay, we paid premium, we go to the hospital, but they are not settling. They're asking for so many documents and they are not digitalizing the document, making our life difficult. So this is one challenge, and lack of trust in the community about insurer and the caregiver. This is the very important problem we are trying to address. I am told, in fact, I have seen research papers by CII, FICCI, and all that on the insurance frauds that are committed. If you go to the Google, you can see a lot of papers that are being written, lot of articles that are being written on fraudulent claims and inflated bills. When you create a patient and then claim the insurance amount from the company. So then inflated bills, the patients are available, patients are there, but they inflate the bills. If they say medical equipment charge rupees, so they will try to inflate the bills using some loopholes. But this is exactly what I'm trying to address. Today I'm going to show you some examples how we can prevent fraudulent claims, how you can reduce, or in the hospitals. I do not know whether we should blame the hospitals for that, whether we should hold whether we should blame the policyholders for that, whether we should hold the insurance company for that, or all of them are conniving together to do it. But reformed. The hospitals are doing well. There are some black sheep. So maybe 80% of the hospitals are doing a great job. They are being very fair. They are trying to use this digital technology. But 20% of them are still not doing it digital, so that everybody complies with what is required to the community. So this is one challenge, and lack of trust in the community Maybe the sales and distribution network of health insurance is not okay, and now you have online insurance get reimbursement through the internet. All that is okay, but what I am trying to do is I am trying to go beyond that legacy system. So that is what we are seeing. This is the general idea. You find that we collect 100 rupees premium, but we pay 127 rupees as the reimbursement. That is where the health insurance is failing, and that is where, health insurance tech, what we are propagating now is going to do immense good. 16, 17, they collected 100 rupees, paid 127 rupees. New India collected 100 rupees, paid 103. And Oriental collected 100 rupees, paid 118. Then United India collected 100 rupees, but paid 139. What will be the incentive for those companies? In private insurance companies, you find that Apollo Munich gave only 55% reimbursement. Cigna 48%. Aditya Birla was again 111. Max Bupa of private insurance, in the name of less reimbursed, they should not be profiteering, and they should not profit. So I think we should allow them a reasonable amount of profit. Maybe they should be able to make about 20% gross or whatever it is. And we should in another direction, we should not allow the insurance companies to profit here. So that's exactly what we are trying to do in this InsureTech. Quickly coming back to to our subject, and these are all the innovative, disruptive technologies in healthcare. UED, artificial intelligence, big data, drone, genomics, edge computing, machine learning, internet, nanotechnology, cloud computing, pneumatics, quantum computing, BFI, Zigbee, mobile, biometrics. When you say biometrics, it may be handwriting recognition or voice recognition, robotic process automation, very interesting technology that is being used. Then robotics, I think you should make a distinction between robotics and robotic process. Real-time location tracking, that's again a revolution in this field. And then augmented and virtual reality. And these are all the innovative and disruptive technology that are being used in the hospitals. But if you see, I would have marked some technologies with asterisk marks used in Indian hospitals. And if you have not used, please ensure that you use them. People like us can help you to use. But if you ask me, can you use quantum computing? No. But as quantum computing being used for healthcare, yes. Is genomics being, but some of these technologies like IoT, BLE, NB-IoT, LoRa, Wi-Fi, Zigbee, biometrics, to cloud computing, already internet, already being used. I'm going to show you very quickly how we can use patient safety during COVID-19. This is extremely important. See, what I told you that Industry 4.0 was already making an impact in the last 3 or 4 years, but this COVID-19 was a tsunami. And so what did COVID-19 ask us to do? The doctors want us to do. They said eliminate human interaction. If you can remotely manage an air handling unit, if you can remotely manage an AC unit of a patient where COVID-19 is there, then to that extent, it is okay in a mall. We can do it. We can do it in education. We can do remote, delivering lecture is possible. But we cannot prevent a nurse. We cannot have a nurse or a doctor not touching the patient at all. You can only minimize the human interaction. So can we use technology to minimize human interaction in the sense that in an ICU, whenever the nurse has to take some readings from the ventilator, readings from the monitor, readings from the infusion pump, she does not have to go. But if she has to go to the room thing, she can do it remotely. So minimum interaction is necessary for healthcare, and they are saying, how have you minimized it to the extent possible? That's what they are asking. And then enable social distancing. We want to see whether the nurses are, maintaining that social distancing, whether the waiting area are maintaining social distance, whether the patient care are maintaining social distancing. Now technologies are available. And see, it is okay if you don't have social distancing in a mall, because not all are COVID patients. But here, when you come to the hospital, you need to be more active. You must be more proactive in a hospital setting using these technologies. And then you have to monitor. Monitoring is also very important. See, in your house, if you are inside the house, if you wash 10 times, it's okay because you don't go out. But in a hospital, you keep in ICU, keep on treating COVID patients, hospital-acquired infection patients. So you must keep on washing your hands. But we don't know whether the nurses are complying to it. Now technology is available where computer vision is possible. We can find out whether the nurse used soap, how many times she used soap, how many times she washed. All that is possible to be monitored using this kind of technology and enable remote monitoring. Remote monitoring is like home care. So you have senior citizens who cannot come to the hospital, cannot provide a ventilator. Maybe we can definitely provide a monitor. We can provide some point of care instruments like diabetes checking instruments, and we can carry those tests into the electronic medical records in the hospital. So the insurance companies should ask the hospitals, and if this kind of framework is there in the hospital, I would strongly urge the the leaders in health insurance industry, like the Smart Plus hospitals. If you see here, hospital information system, EMR, customer relationship management, ERP are all legacy systems. You go to any good hospital today, whether it is Apollo Hospital or Kaveri Medical Hospital, these softwares are available for the past 10 years. They are all legacy systems, and they are all a must. Now you can't say I won't have an HIS. But looking at different other completely a new paradigm is a completely a new software, new platform that is developing, and then IT enabled supply chain management and national health digital mission. It's a platform. It's a national platform where all the service providers will come into that platform. All the maybe the insurance companies will come into that platform, and maybe every individual in the country will have a UHID, universal health ID, like Aadhaar ID. It will provide interoperability, norms, and maybe Fortis Hospital can share the data with Apollo Hospital. Apollo can share it with the MGM Hospital, and that is going to be a part of the entire ecosystem. And then the connected health. Now, do you know 25% of the hospital don't come to the hospital? Now, although the COVID situation has eased, we find patients are coming, but still they are little apprehensive coming to the hospital. So this continuous monitoring, we call it the continuous systems, and of course the infrastructure management is very important, like building management and all that. So I feel that the insurance companies should ask for a smart hospital framework, find out what are all the facilities that are available in terms of digitalization if transformed hospital. So just to give you this hospital operating system software becomes the glue, that becomes the basis for integrating many of the other concepts which I have developed, and I'm going to show you some examples. This hospital operating system platform will integrate IoT systems like sensors, gateways, devices, and equipment. It will also integrate the third-party software. That is, if you have a credit card which you have to pay, you have to integrate that credit card system of SBI or maybe HDFC into our system. So they give you an API and you have to. There are companies like Philips. Then you have company like Zemed. The Zemed is one company, Choirmed is another company, and those companies provide charting solutions where the patient's data is directly the equipment data is directly taken from the equipments like monitors, the infusion pump, and it is put inside the electronic medical records without the need of the nurse to go to the equipment and take the readings. So it completely automated, so it minimizes the human interaction with the equipment. Viral load is less. And then you also have equipment integration. You can also have to do equipment integration like laboratory equipment like auto analyzers, hematology analyzers, urine analyzers, then picture archival coming. Then you have to integrate with the platform that is going to come, the NDAHM. So all these have to come together on one particular platform, and that is what I'm saying. I'm calling it as hospital operating system. Hospital, all these systems will talk together, and it will create a data lake. It will create a data lake where in that data lake you can apply algorithms, you can apply artificial intelligence, machine learning, and do a lot of other things. Now these data are existing in silos and they are not useful. But now with these platforms coming in, things will different. And this is where these insurance companies will access this platform. The insurance companies will not insurance companies will not the insurance companies will not be accessing the individual softwares, but they will be accessing this operating system. Whether it is monitoring the ventilator, whether it is monitoring the patient who is insured, to whom they have to reimburse, all that will be done through this platform. And this platform will provide manual data entry if there are small also allow some of these IoT systems, but IoT systems don't get integrated into some software. So you can virtually take the data and put it into this platform. And the third, of course, is directly integrating this IoT system. The sum and substance of this is that we want to aggregate data. We want to bring together into one platform, so there is a single sign-on for the user. So just coming quickly to this, I think this is very, very important, and whole presentation. And I just took one example. If somebody had a open heart surgery, so we pay about 2.5 lakhs. But have you ever seen? Please, there is a disclaimer. It does not belong to any hospital. It does not belong to any doctor. It does not belong to anything. But this is the general industry standard. So, you please don't anybody for this. But this is only an example for you to understand how these charges are classified, and how we can monitor these charges using IoT solution for the benefit of the patient, for the benefit of the hospital, and for the benefit of the insurance. About this, you have medical consultation fee, the assistant doctor fee, room charges, ICU charges, laboratory charges, radiology charges, material charges, ambulance charges, non-medical charges. These are all the charges that you have to pay 2.5 lakhs. But I did a ABC analysis of these charges. So, what are the major charges? You have maybe medical consultation fee is a major charge, ICU charge is a major charge, room charge is a major charge, one of the charges. But as far as the material charges are concerned, they are all materials. They will tell you catheter so much. They'll give you a breakup. They will give you your brand. They will give you the price. And nice thing about this material charges, now government for catheters, they have charged the charges for some of the medicines and your processes and all that. So the government has taken care of that. So our insurance companies, people don't have to bother much about it. But what they have to bother about some of the ambulance charges. They have to bother about some of the room charges, maybe room charges, whether they have been charged properly. I want to give a small stop here and then find out from Krishna and maybe Saga, are you audible? Hello? Hello?
Sir, what, it was a great
It was a great presentation.
up till now. I don't, in the comment section, we don't have much questions as of now. You may continue and we will see if we have more questions.
But it's all over. The presentation is visible. and audio is okay, right?
Yes, sir. Yes, sir.
Yes, sir.
I
It's
So,
want
all
to
good.
confirm. Okay.
yes, yes,
So,
sir.
so you find that these are all these are all the charges which the insurance companies have to monitor. So, you can monitor the intensive care, ward, ambulance, patient charting systems. We can monitor medical equipment and location and usage monitoring for billing. You can use billing, operation data utilization for monitoring and billing, patient admission and ICU stay monitoring, wireless IV fluid drip infusion, virtual inspection by the insurance company doctors, virtual inspection facility of the for the health insurance company doctors, online purchase of insurance policy, assistant doctor charge certification in a different color. They can even check whether the temperature and humidity and pressure of different places and refrigeration equipment is maintained, whether the temperature and whether the AC systems are working, are they really getting AC comfort? So for all you know, the insurance company is paying for an AC room, but they may be placed in the AC room, but they may not get the AC. They would have switched off the AC. So then wireless PPE counter for social distancing would as per the government norms, and whether the patients who are coming, their own patients who are coming are safe, and then the nurse call system so that the nurses come and address them urgently. So quickly, I'm going to show you the intensive. This is going to be the intensive care. I told you in the intensive care ward and ambulance, we use a lot of equipments, and based on the usage of equipment, they charge. But if they say that I use ventilator, I use ventilator and monitor and infusion pump, how long they use it. They say that I used it for 4 days. Did they use it for 4 days, or they did it only for 3 days and charged it for 4 days? And maybe for all you know, the hospitals can be benefited, because if you have an IoT device put on that equipment, that equipment and that IoT device will track where the ventilator is, whether it is in surgical ICU or it is in a cardiothoracic ICU. Then monitor the charges into the hospital HIS billing module, and the billing module computes as per the business rule of the hospital, and then the charges are made onto the billing system. So once that is done, so everybody is empowered, everybody is happy. There is a complete transparency, there is complete accountability for the charges they have made. So it benefits even for all you know. The hospital, if it wants, can show that ventilator is being connected, and it is being people in United States, somewhere residing in Boston or something like that. They don't have to show the patient data. Please understand, the privacy is not breached. Security is not breached. We are only showing them the which they require. And the operation there, similarly, the same thing, ambulance tracking. I'm going to show you some example. We can track the ambulance through each GPS and IoT system. We know when, at what time it went to the accident scene, how long it stayed in the accident scene, when did it leave the accident scene, and when did it return to the hospital. In fact, when the door was opened, when the patient was brought, we can monitor whether the swells were using the siren when they were coming. Some of these ambulance drivers have a practice of using the siren when they were coming. We can even monitor whether these fellows were using the siren when they were coming. Some of these ambulance drivers have a practice of not using the siren even if the patient is not there. So we can monitor whether the siren is. We can also monitor the speed at which the ambulance was transported. Please understand, there have been accidents while the patients were being transferred. In fact, I had at least about 4 or 5 incidents in my own career. I found that when the patients were being transported from Namakkal to Coimbatore, one of the ambulance got injured, driver also got injured. So we can even monitor the speed of the ambulance. We can know how many times the ambulance stopped. It is something like a Ola, Uber kind of system. And today in our hospital, in MGM Hospital, we have implemented 7 of our hospital vehicles. We have done it for 2 patient vehicles. We have cars. We have done it for 2 ambulances. We have done it for transporting the nurses and all that. We can track and we can manage them very well using this IoT. Important patient hospital admission and ICU stay charge. I told you in that breakup, the ICU charges account to almost about 30,000 rupees because each day we spend about 5,000 to 6,000 rupees as ICU charges, and we want to know whether the patient really stayed in the ICU charge. So what we do is we use this BLE band, and this BLE band, like an RFID band, it can communicate with the BLE gateway, and that gateway will tell you in time and out time for every time, in time, out time, time stamping will be there. I'm going to show you, and we know exactly when did the patient enter in and when did the patient, something like having a security guard and noting down the readings. It is humanly impossible to track all such data in every place that the patient goes or an technology that is being used. It is called the real-time location tracking system, which I am going to show, which the insurance companies can definitely use. The insurance companies can definitely use, hospitals can definitely use to reduce the cost of the car. Great facility, wireless IV fluid infusion, and many times we charge the patients for nursing charges. And this is a system where we put an IoT device in the IV stand. We are able to find out how much of IV fluid has gone into the patient, whether they by any chance did not see, and so air gets into the system and air embolization happens, or sometimes even the reverse flow of blood comes into the IV set. So such dangerous things can happen. We can prevent them. It is a patient safety device, but at the same time, it also a health care for which it is being charged. So this is virtual inspection facility is a great facility when we can do NABH inspection, when we can do NAC inspection, when we can do JCI inspection virtually. Why not the doctors from empaneled hospitals? These doctors are supposed to go at random to some hospitals, pick up some of their patients' records at random, find out whether that patient exists, find out whether the procedures they have indicated in the claim have been done, and they even take photographs or scans of some of these medical records and upload it to their central office. See, now this with this IoT system coming in, with this remote hospital operating system software platform coming in, those doctors see every patient of them virtually, and I am sure it is going to be a great boon for the insurance industries if they are going to adopt. But only condition is that hospitals which are these hospitals. If you push these hospitals to implement this, they will do it for their own good and also for the good of the patient, for the good of the insurance company, so that the prices can come down. The whole healthcare costs in the country can come down. In my opinion, this is a big deal, but I just wanted to mention how digitalization can help in the insurance industry. And this assistant doctor charges, if you see in many of the bills, they will put consultation charges 40,000 rupees, assistant charges 5,000 rupees. But we want to know doctors now. There is so much of shortage of doctors that they can't find. They put that they can't find. They put all these allopathic medicine doctors are not there, so they put Unani doctors, they put Ayurveda doctors into this, and there are though they are not supposed to put. That is the shortage of doctors are there, and you charge for them. So we want to find out whether such doctors were there at all, and if at all they were there in the operation theater, how long they were there. We charge only for the presence of those doctors which you have found in that IoT system. So see quickly, these are all the ecosystem. Say I told you in the start of the conversation that IoT is going to be a great boon for the insurance industry. computing, artificial intelligence, IoT, robotics. These are all used, but the rest of the technologies are not discussed today, but is being used now. And these are all some of the. This is the wireless drip monitoring, tracking of the medical equipment, tracking of patients. This is a small tag we put on to the ventilator, monitor, infusion pump. This is a BLE, Bluetooth low enabled tag, tag that is small sensor, BLE sensor, which is put in the refrigerator, cold storages, in some of the cold storages where we store biochemistry kits, reagent kits, and we can monitor the temperature that is given to the patient or given to the employees for tracking them. And this is the ambulance track bus. And as I told you, this is the IoT device we have put in 6 of our where we have put, we can track. And this is the gateway. This is the LoRa gateway. I don't want to get into the detail, but it is enough that these are all some of the technologies and some of the devices which use in the so-called InsureTech, because you are all technical guys. Secondly, they are not expensive. What you must understand is this entire IoT system. I have been implementing conventional building management system in hospitals. I've been using Siemens. I've used NIDER, but they are little expensive and you cannot afford because they're all wired systems. Please understand, all those systems are all wired systems. Just imagine running wires for about 600, 700 sensors. You have controllers and you have sensors, and 30% of the cost is accounted by the wiring. But with this IoT, we can knock off that 30% of the cost. So if it was costing about 1 crore for a 500 bed hospital, and the nicest thing about this is that you can go in phases. You don't have to do everything together. You can monitor ICU charting once, then you can do ambulance tracking later. You can do maybe water and so you can implement it in phases. You can implement it in parts. And the only thing is the maintenance is very easy. And now a lot of IoT is the in thing, and a lot of data is coming. So it is this is what it is. So quickly, I'm going to show you some of the practical examples. This is a typical ICU of our hospital, like Koya Medical Center or MGM this we have kept these IoTs, monitors and ventilators, and nobody need to go and like she's recording now. We don't have to record like that. All will directly flow into this computer system, which I'm going to show you. And these are all the, and this is an infusion pump, and you have an IoT device placed on it, and all these data directly come into this into the electronic medical record. And this is exactly what I want insurance companies to have a look. Maybe not interested in knowing what vital data, but I can tell you this vital data, because you're all biomedical people and some of these engineers, you're all engineers. You must know that the IoT devices can pick up all these data every 5 minutes. You can chart it every 10 minutes. You can chart it every 2 hours. But the nurses do it once an hour. They keep grumbling because there is a human fatigue and resistance. But these IoTs can endlessly. Please understand, endlessly tire. The patient care is very, very good and it improves tremendously. So this is not only used for patient care, but it is also used commercially for monitoring whether the equipment is working, how long it has worked. And these are all some of the you're all engineers, and this is the power of IoT here. But now what I want, this slide I want you to see, for my sake, bestow some attention to this slide. We want to know this particular inpatient time, out time, duration, what is the IP visit number of the patient, what is the UHID of the patient, what is the OP charges or IT charges, and what is the OT charges. All that gets we can compute it straight away. This is the technology. This is the beacon tags I showed you. This is the cloud sense, that is the gateway, and it goes through a wireless network. It can be Wi-Fi or BLE or Zigbee or whatever. Then it goes, and many of the hospitals like Aster, MGM Hospital, Apollo Hospital, Royal Care Hospital in Coimbatore, on many of these hospitals have done a fantastic job using this charting solution, and also these patient tracking. This is the typical screen of RTLS, where we can track a particular patient. This is a patient called Sendil, and data, and you will see we are able to track him at what time he entered, what time he exited, how long he was there. The exit time is also not in which floor, which spot he was there. We can track from the fantastic tool. And I am told that this real-time location, this is called indoor real-time location tracking, but GPS is an outdoor location tracking. But I am told that the indoor real-time tracking is in our houses. 70% of the time we spend in our buildings, like colleges, hospitals, hotels, malls, and all that. So tracking the people, tracking the assets inside a hospital is going to be more important and more useful. And this technology is 4.0 to 5.0. We are talking about ultra wideband tracking, and there are different technologies. I don't want to get into it, but I wish that some of you you see here, like you see in Ola and Uber, we can track this patient, where he was, POP, how he was there. We can really see the movement of that patient. We can see the movement of the asset. And this is how we data capture screen actually. The report you get like this. The asset tracking, I told you, these are all the devices, IoT devices. And this is the fine. We put this tag onto this infusion pump and syringe pump, and it moves from emergency to operation theater to ICU. We are able to see OT. We are able to see when it came into the pre-op, when it went into OT1, when it came back. The master health checkup patients. Master health checkup patients, we claim, even insurance companies give you some benefit for health check. So whether they really underwent health check, they can find out what was the MSC lounge, doctor consultation. You may be wondering why you are monitoring for pantry. You know what? It's very, very important in the sense that patients come for master health checkup, and they have a fasting some food, in the sense breakfast, and after breakfast they are supposed to do a blood test 1.5 hours after the breakfast to see the postparental sugar. So we send a notification once they get into the pantry. After 1.5 hours, we send a notification saying that you are due for postparental sugar. We also send a notification to the nurse or a receptionist so that she can follow up with that patient. So this may be a very small thing. Patient come tomorrow for doing postparental sugar. So there are a lot of things we can do, and this is the wireless monitoring system we are talking about. So you can reliable drop sensing, heat on a tap. So the patient IV fluid is connected like this, and we will be able to see. And this is where the nursing charges can be computed using this IoT device. This is how the device look. And in fact, one of your and developed it. And he got an award for developing a best IoT device for the patient monitoring of the drips. Okay, this is the ambulance tracking system. This is the ambulance. I think this one statement I want to spend 1 minute. An emergency room manager can be as important as a neurosurgeon, if not more, in a hospital for a head injury patient and the insurance service provider. And ensuring the can save a permanent disability to the patient and 5 lakhs of rupees to the insurance company. Suppose there was a mass casualty and if 2 ambulances go and the first ambulance comes with 2 patients, another ambulance for some reason gets stuck in a traffic jam and blood every second it requires blood. Maybe if you stop the blood for about 5 to 6 seconds or 10 seconds or 15 seconds, to that extent the cells get damaged and then the some kind of a morbidity sets in. So I have found if you have got this patient about 10 minutes before, I would have saved him because by the time the blood clot had happened in the brain. So I think the ER manager, this software, IoT software to me is as important. This seems stable. I think I'm important. This technology is important. This software is important. So I think you can also contribute by using this, and you can feel God. You can feel whether whether I am the so this is the actual monitoring you will find, and you are able to see at how many kilometers from start times to end address, what is the trip ID, date time, all that we are able to track. And this is the software. This is again a very important slide. You should have a look. What is the date? What is the vehicle number, driver number, paramedics name, trip type, passenger type, patient name, UHID, IP, OP number, start location. All that is captured into this data. This is a very interesting application. You will find that this is a device people counter for social distancing. If you keep this, you will be able to know hourly trends of how many people are wearing mask, how many people are wearing face shield, how many people are wearing manages social distancing. It generates a real time people trend. It tells you if there are 10 people instead of say 5 people. It tells you there are 10 people and social distancing is not maintained. And it gives you people where there are how many people violated the social distancing. All that is because of this computer vision and this. So I think this is a very interesting example. I got, see, in one of the hospitals I was trying to go on rounds and find out whether they were maintaining the and after some time I found some temperature readings were maintained. Then when we put an IoT device, all that data come directly, so there was no dependence. And in one case I found a spike in the refrigerator temperature. We found was temperature. We found was almost about it went up to 26 degrees in a refrigerator. How can it go to 26 degrees? Because somebody had opened the door and started taking inventory of the open for 2 hours and take the medicine inventory, which will spoil the care. But for this IoT device, I wouldn't have known. I monitored it from Coimbatore and told some hospital in Bangalore. So I think this is if these limits, we can set temperature limits, we can set temperature alerts through through maybe SMS or maybe telephone, telegram or whatever it is. We can send messages. Opens this and keeps it open, and we are able to know somebody has a bad habit of opening it and keeping it. Somebody goes and closes it. So I think knowing is not enough. We must apply. Willing is not enough. We must do. So thank you very much. I think I took a lot of time, but I thought still it will give you an oversight of what this InsureTech is about. Krishna and Saga, if you have any questions, maybe you should ask me. I'll try to answer. And if audience have any questions, I'll be only too willing to answer.
So we have a few
So,
questions from the audience, sir. We'll go to those questions from the audience, sir. Is it okay, sir?
yes,
Yeah.
sir. So, firstly, I just had a general question as to how much do
Sir,
you think that we will save, sir, like by cutting down on so much cost on a global level not on global level, but on a national level, like India as a country, how much do you think we will save per money? How much money will be saved per year?
The straight answer is 20 to 30%. 20 to 30%.
Okay.
okay, sir, and we have one more question from the audience, sir. Sir, the question is asked by Krishna P. Is it
Yeah.
possible to make a global database where a patient can go to any hospital and the records will be available throughout the world in a giant hospital patients record database?
That's what National Digital Health Mission is attempting to
Sir?
do. It is possible, I guess, that in another, say, 4 or 5 years' time, that will happen in this country.
Yes, sir. Okay, sir. So, and we have a few more questions from, I have a few more questions from my side, sir. Is it okay if I ask?
Yeah, sure, sure. Please go ahead. Please go ahead.
Sir, the question that I would ask is, what does the future look like for InsureTech in the healthcare industry?
It's very, very bright. I find that there is a lot of traction for this kind of applications, basically because they have become very, very inexpensive. It is something like your mobile. When we used to buy a mobile for 10,000 rupees, 50,000 rupees, now we are able to get a smartphone for 5,000 and 6,000 rupees. So you find that the cost of IoT devices coming down, cost of software coming down, the potential is very, very good for IoT technology, artificial intelligence in hospitals. And I want to remove that myth. There is a myth that these technologies are expensive. Nothing comes for free, but it is not expensive. And if you can optimize the implementation, optimize your use, I think you will derive a great value out of this.
Yes, sir. Sir, another question that I would like to ask is, how do you suggest in overcoming the resistance that might be faced in implementing InsureTech in the private sector, like in private hospitals as of such? That is the resistance by the owners or fund trustees as of such who run the hospital.
Is implementing this IoT technology or IoT maybe applications, he has to get to the ground level. He has to get to the ground level. First of all, he must understand clearly, and he should not expect the users to come to him. He has to go to the user. Very, very clear. You won't believe, even at my level, I talk to the security officer, I talk to the assistant who is entering the hospital, I talk to the nurse, I spend a lot of time with the nurse. But sometimes they get irritated. Believe me, they will get angry, they will get irritated, and they will talk something which is completely irrelevant, pursuing your goal. You must be very persuasive, and you must be very persistent in your approach. And if you can show value once, believe me, now in my hospital, if you come, I can show you live management is IoT, entire environment management is on IoT, and now the people are after me. You find the department managers, the department assistants are after me. They are asking my time. Please implement this. We find it very, very useful. So I think now I am very excited about the implementation we have done in the hospital. I think it is the ownership is on the person who is implementing the hospital, but no downing from the top management. The support from the top management is extremely important. That way, I think I have been blessed. I have the support of the top management. People understand it, and I think you also understand it. long, what you would say, brainstorming session with users and the top management and try to convince them. And one thing, never give up. I'm telling you, never give up. First time you will be said, sorry, we don't want it, it doesn't work. They will keep on telling you. But politely, nicely, keep following up, following up. But be sure about what you're doing. As long as you're sure about what you're doing, you will succeed. There is no two ways about it.
Yes, sir. Sir, a few
Yes.
last questions before we wrap up the session, sir. Uh, what is the impact and the reach of IoT in healthcare in the present day scenario, like the reach of IoT in the current scenario as of such?
Pardon? I didn't get you.
Sir, the reach of IoT in the present day scenario, sir, like how far, like how many hospitals use it to track devices and every, like to track everything, like for health policies.
I must confess, it is not even 1%. I must confess that is not even 1%. And that is where I see the value. See, it seems about 20 years ago, the Bata company wanted to sell shoes in China, but they knew that there was a huge population in China, like India, and the European market and the American market. So they called two youngsters like you and they said, okay, one of you will go to the North China, one of you will go to the South China and explore how you can sell sell shoes. Area. But you know what? Saga came and said, "Oh, sir, the problem is in China, the people are not using it. But Krishna said, no, sir, we will sell whatever we sold in Europe, we can sell in China. So I think the same thing applies to you also here. So because there is only 1% of the people have adopted this technology, but I'm telling you, people who are going to use this technology and the people who are going to implement this technology are going to immensely benefit by this. They are going to make money out of this and also benefit the country. I am done. Yeah. Yes. Yes, next. Saga, I'm not able to hear you. I'm not able to hear you. Your mic is muted, I think. Hello? Krishna, your mic is muted.
Sorry for the interruption, sir. So we there was a slight loss in the connection. So I would like to ask one last question before. Okay, looks like sir is having internet issues from his side as well.
Hello, am I audible?
Yeah, you're audible. You're audible, Krishna.
Oh, okay, cool. I think there was a problem where we all
Yeah.
disconnected.
Yes. So we'll be joining back in a little bit. So, does anybody from the audience have any further questions that they would like to ask, sir?
You can please put it in the comment section.
Okay. Yes.
Are you able to hear me now?
Yes, sir. Yes, sir. Yes, sir. We are
Yes,
able to
sir.
hear you, sir.
Yes, sir. We can hear
Sir,
you.
Yeah, I think for a moment we lost the connection. Yeah.
Yes,
yes,
sir.
sir. Sir, I have one last question. The question is, what policy changes would you like the government to make and to implement in order to ensure that InsureTech functions smoothly in the healthcare industry?
I think the government must first, for having this kind of an IoT system, they should incentivize. If you see in insurance, they have given graded the hospitals into different levels. The level 2, level 3, level 4, level 5, level 6, all that. In the same way, I think you should grade these hospitals, and once you grade these hospitals, then it becomes easy for the hospitals to share. In US, when the Obamacare came, the government incentivized people who used electronic medical records. In the same way, like Obamacare, if the government can incentivize cutting edge technologies in healthcare, I think then it can really catch up. And and secondly, they must make it mandatory. Your cash transactions, if it is more than say, okay, in the same way, government should say, if you are charging the if you are doing some open heart surgeries, kidney transplants, heart transplants, and all that, and if your bills are going to be if your bills are going to be included into a smart hospital, in the interest of patient safety and in the interest of transparency. If you get what I'm saying, one is they should incentivize. Secondly, they should incentivize. Secondly, they should put a rule saying that if you bill the patient more than 3 lakhs or 4 lakhs, there must be completely recognizing should be rewarded. These hospitals should be given some kind of a recognition in some public forums, saying that these hospitals are a role model to the country, recognizing them, incentivizing them, and then implementing certain rules like saying that you should have an IT system. Three things if they do, it will really catch up. Yeah.
Yes, yes. Thank you, sir. I guess we are at the end of this session, and we would like to thank you for your very precious time that you've spent with us. And we've gained a lot of insight as to what goes on in the healthcare industry and how InsureTech can benefit in that healthcare industry. Thank you for your time, sir. We warmly thank you for whatever you've taught us today. Thank you, sir.
Thank you.
Yes, sir. It was a really insightful session where we all learned a lot.
Thank you very much. Both of you did a great job, Krishna.
Thanks a
Yeah,
lot, sir.
thank you, Krishna and Saga. Both of you did a great
Yes,
job. Thank you very much. Thank you, one and all. Thank you, one and all.
thank you.
Thanks a lot, sir.